My name's Charlotte Paulin. I'm a haematology doctor specialising in myeloma. I work at the Royal Marsden Hospital and I'm currently doing some research here at the Institute of Cancer Research looking at developing new treatments for patients with myeloma. Myeloma is a cancer of a particular kind of cell that's found in the bone marrow. It's also sometimes called multiple myeloma. The bone marrow is the jelly-like substance in the middle of some of the bones in your body. The plasma cells in myeloma grow out of control, and so there are too many in the bone marrow. Myeloma is more common in people who are over the age of about 60, but we do sometimes see it in patients who are younger than this as well. It is slightly more common in men than women. The most common symptoms that people would notice are pains in the bones, having more infections than normal, or feeling generally unwell, for example, feeling tired or lethargic, or losing weight without trying. The protein can also clog up the kidneys, and that means that the kidneys don't work as well. Having too many of these plasma cells in the bone can also cause some damage to the bone and some pains in the bones. These pains are most commonly in the lower back or in the ribs, but can be in other bones as well. If you were to notice any of these symptoms, the first step would obviously be to see your GP and discuss the symptoms that you are having. What the GP might do would be to arrange some blood tests, and if they suspected myeloma, to refer you to see a haematologist. The haematologist would review all of your symptoms, the blood tests you'd had so far, and possibly arrange some more tests to investigate the possibility of myeloma. There are lots of different treatments available for myeloma, and many of these have been developed over the last 10 years, and so we now have many more treatments available than we did in the past. The newer treatments that have been developed are called immunomodulatory agents, such as a drug called thalidomide, or proteasome inhibitors, such as a drug called bortezomib. And these are normally given in combination treatments along with a more classical kind of chemotherapy and a steroid treatment. Depending on the way that a patient's myeloma presents and the problems that they have associated with it, it might be that one or other treatment is more appropriate at that time, and this is something that the doctor would discuss with them. The aim of treatment is to get rid of as many of the myeloma cells from the bone marrow as possible and to keep them away for as long as possible. The treatments are usually well tolerated and work very well, such that a lot of patients can remain in remission for long periods of time. More information would be available from a haematologist or your GP, and there's lots of information available on the Macmillan website.